I will, got it. So hello, everyone. Thank you so much for joining us today. My name is Anne Marie Charlesworth, and I am the Director of the Community Engagement Corps for the EaRTH Center. And we have a very exciting presentation today to share with you. One of our first launch of the Environmental Scholars Program happened in the spring, and we have 4 incredible environmental scholars who are going to share their projects, their summer internship projects in environmental health with you. So I'm going to start sharing my screen just so I can introduce the rest of the team and tell you a little more about the Environmental Scholars Program, and then ask all of the scholars to share with you about their internship experiences. So let me go ahead and start screen sharing. There we go. I hope that I'm going to look for a nod from Alana that everything is looking good. Great. Okay, so this again is the UCSF-Earth Center Environmental Scholars, and it's part of our P30 Center grant. And I'm gonna, for some reason I can't move my, okay, here we go. So just a little bit about the scholars. This is a program for, it's a 3-year program for medical and nursing students. The students, they have to apply to get into the program. And typically we started off saying we would only take 2 students per year, but we had such a phenomenal group and amazing applicants that we doubled it and we took 4 this year. The program again starts with the summer internship experience, and it's really meant to give students a community perspective in environmental health. And then after their summer internship projects, they move into designing a mentored research project for years 2 and 3, working with both EaRTH Center faculty, but other community organizations as well in designing that project. They receive a total stipend of $10,000 for the 3 years to participate. And the last important thing that I want you to know is that this is modeled after the California Department of Public Health Occupational Health Internship Program that was designed by Dr. Bob Harrison. And so this is really his brainchild, and he wanted to bring this to medical students. So I'm going to stop and let Bob just say a few words about that program, and then we're going to introduce the scholars to you.
Thanks, Anne Marie. This is fantastic. I'm just really happy that we're going to hear from these 4 fabulous students. The idea is really what worked for me 40 years ago is going to work for you. I spent a summer working with a chemical workers union, learning about workplace health and safety hazards, and it totally turned me on to a career in occupational health, occupational medicine. And I thought that by having a summer involved from the ground level, engaged with research, that it might help you as you are thinking about careers, whether directly in environmental medicine, environmental health, or a related field, or if you just decide to do something completely different, that you'll remember that the environment plays a really critical role in the health of your patients. So the idea was these research projects would be directly engaged in something that is of direct consequence to patients and community health, that you would both learn something and then also think about how to continue with your research and scholarship and ultimately help give back to the patients and the communities that you worked with. So that's really where it comes from. We've had, by the way, on the occupational health side, 350 plus students over the last 18 years. So you 4 are just the beginning of what I hope will be an environmental scholars parallel, because we just really need people in environmental science and research, I think it's really evident that, the Earth is really at a critical moment. And we just need people more than ever. So I really thank you for all the work that you've done in advance of hearing your presentations. Back to you, Anne-Marie.
Thank you so much, Bob. That was great, a great overview, and that really helps put this in context. It's a pretty exciting program. So I'm going to go ahead and introduce the scholars. And here we go. Okay, and this is going to be in the order of their presentation. So first, we're going to have Lizbeth Cabrera, who is a nursing student now in her second year. And she did her project with Bayview Hunters Point Community Advocates. Then we'll hear from Madeline Matthys and Olivia Leventhal, who both did their projects at PSE Healthy Energy, which is physicians, scientists, and engineers for healthy energy. And then we'll hear from Ana Claire Fernandez, who is also a medical student. She's part of the joint medical school program between UCSF and Cal. And she did her summer project on wildfire smoke exposure. It was a community research project. So I'm going to go ahead. We are going to have hopefully time for some questions at the very end. So if you'd like to pose some questions in the chat box, if anything comes up, we'll make sure we circle back at the end. And of course, if we do run out of time, we can certainly facilitate those questions in a continued dialogue after this hour. Okay, so I'm going to turn it over to Lizbeth.
Hello, everyone. Thank you for coming to our presentations today. So as Anne-Marie mentioned, I was at the community, a Bayview Hunters Point Community Advocates for my summer internship. Just a little overview of the organization. It was founded in 1994, and the organization provides a variety of programs targeting food insecurity, currently COVID with COVID testing and COVID vaccination, as well as other programs of advocacy within the organization. So one of the main branches of the organization that I personally worked with was the community outreach team, which was mostly focused on COVID-19 vaccination efforts in the area. And I helped or assisted with strategizing how to survey the community's needs, as well as talking to folks about COVID vaccination. I went to multiple COVID vaccine pop-ups that they had over the summer. That was in collaboration with a local organization and SFDPH to provide vaccination for folks who still hadn't been vaccinated. Next slide. So one of the other parts of my project, I felt like I did a few little things, like a little pieces of multiple projects through the summer. But as I said, I assisted the outreach team, which consisted of like 3 to 4 volunteers. And we would go out into the community and identify people who wanted to get vaccinated. While doing so, we often got information about the needs that the community needed, especially the immediate community around the Community Advocates Center, which is on Gerald and, oh, I forgot the other name, but I have a map coming and a couple slides showing a little bit more about the area. But there are many people who are housing insecure, food insecure, people living on the street, as well as living in RVs on the street. So there were a variety of needs brought to our attention, such as food, bathing, hygienic needs, as well as laundry services. And when I joined the team, we wanted to find a way how we could quantify the needs so that we could advocate for resources to be brought to the area. So I assisted with creating a survey that we could implement to help quantify the needs of the community. I also created a map to visually show the areas that the outreach team visited so that they could see what areas they needed to visit more, or some areas that were high need, which, as I mentioned, that immediate area by where the Advocates Center was, was an area that was particularly impacted. And another project I worked on was creating a list of resources that was available in the Bayview Hunters Point community, so that when we do outreach, we have something to give to people if they are food insecure or looking for housing resources or health resources. So this is the map that I created, and it's kind of zoomed out. So, but basically, I was given a list of interactions that the volunteers had done over the past maybe 2 months over the summer, when asking folks whether or not they needed a vaccination, if they were interested in getting vaccinated, and then they would also ask, sometimes they would note down what other needs or resources were requested. So I just kind of highlighted by number of interactions. There were certain areas that were visited more often than others. And so the yellow dots are between 1 to 5 interactions, green 6 to 10, blue 11 to 20, and purple 21 to 30. Again, this was only a month's worth of interactions, and unfortunately, I didn't get very complete information, but it was something to work off of, and I gave the outreach coordinator that feedback so that in the future we could have more complete information to work off of. So if Anne-Marie clicks on the next animation, I think I have a more zoomed in photo. So on that purple dot between Gerald and Toland, that was actually the center of the community advocates, like their home base. So the outreach team actually often left from there, and we would walk out into the main areas. And this particular area is mostly warehouses. So because there's very minimal parking restrictions, there were often many RVs that were parked in where people were living. So there was, this is one of the areas of where the most of the interactions occurred, which makes a lot of sense. There was a high need. It was one of the main areas that the outreach team went to first. And yeah, I think that's all for this slide. So just some highlights. I was very interested in working with the Bayview Hunters Point community because I was eager to learn more about this community's experience with everything going on, not just COVID, but the community is also very aware of chemical exposure in the area due to historic naval shipyard, the historic naval shipyard. So if walking around the community, this is actually a picture I took to the right. Well, this is right to me, but so there's a lot of these signages at businesses and also across sections where people want the city to be accountable for doing a more thorough investigation on what toxic waste is still in the area and its impact on the community. And another reason why I was really interested in learning about the community was because of my previous work with PRE. I was a research coordinator working on a research project and based out of the SF General. And a lot of my participants actually lived in this community. And I had learned so much about the challenges that they faced, not just with environmental health, as well as other social determinants of health. And so I thought that this would be a great opportunity for me to learn more about what we as me as a future healthcare provider could focus on in terms of primary care. And I learned so much from talking to the people during the community outreach. I learned about the challenges and the unique obstacles they faced in the area, especially for folks who live in RVs, which was something that I hadn't seen or learned of prior to my volunteer experience. Vaccine hesitancy, as I mentioned, I did a lot of work with reaching out and helping people get vaccinated. And I had conversations with folks who were just not feeling 100% about the vaccine safety. And I also learned a lot about the strengths from the community. I met with the outreach team multiple times and learned about the different ways this community is resilient and has come together to really survive what is seen as a very challenging environment to thrive in. Next slide. So some challenges. When creating the survey, it was pretty difficult to come up with a way that we could quantify the needs of the community without compromising the safety and privacy of folks, because, and also just having folks talk to us as well, because people in this community are often, they have a lot of mistrust in the city and affiliated programs due to street sweeping and a lot of policies that have been implemented in the past and that are currently in place. And so it was brought to my attention early on in my internship that we had to kind of really take a lot of caution when surveying the community, when collecting information in order to maintain rapport, but also so that we could get future participation in these surveys. And but also just again to protect their privacy and maintain their safety. And so we started the survey. I created the questions for the survey, but unfortunately I haven't really seen the final product. And the idea was that the survey would be implemented when the team started their toxic chemical index survey, so that they could go out and do them together. Yeah, so the other part was creating a survey that had questions that were relevant for the community. So I had research experience in the past, but I had never created a survey myself. So this was a really interesting collaborative and learning experience for me, where I was able to learn a lot about the community, work with the volunteers to come up with questions, and also implement what I had learned from research in terms of what are the goals of these surveys, how can we implement them so that they are done easily and quickly without inconveniencing anyone's time. And so community value, the survey, as I mentioned, is something that we're hoping will help bring more awareness to the needs and challenges for this community. So the hope is that we will be able to bring out resources to the area and then potentially leverage more funding for the resources and organizations that are already in the area providing services for this community. And then the interaction map, I'm really hoping that with time and it can get updated, and then the team can really get an idea of where they're visiting, areas that they need to visit more to better guide their outreach efforts. And so personal and professional value, for me, I found this experience very important. I really appreciated everyone's time and for all the conversations that I had with the community as well as the volunteers. It has basically narrowed or helped me refine what I want to focus on my research project for the ESP research program. So I have pretty much decided that I would like to do a literature review, learning more about environmental health screening, especially in outpatient clinics. So I would like to learn more about where is this occurring and how is it happening? For example, are people being asked about where they live, their occupation, et cetera, in like primary care clinics before they see a provider, when they see a provider, who would they like to talk about these topics with, a social worker or the healthcare provider or a nurse, and like what is working and what needs to be improved on. So there's, I think, a lot to learn in terms of my nursing education and training. We haven't really covered environmental health too thoroughly. So I am excited to see what is happening in areas that we can improve, especially because I plan on becoming a primary care family nurse practitioner. So creating effective tools to help advocate for our patients and their communities to really empower them to create change and hopefully have better health outcomes is ultimately the goal. All right, thank you so much.
All right.
Thank you so much, Lizbeth. I'm sorry if I advanced prematurely there. That was great. Thank you. And I'm going to turn it over now to Madeline Matthys.
Thank you, Anne-Marie, and thank you, Lizbeth. That was fun to hear about. So my name is Madeline. I am a second-year medical student now in the School of Medicine, and I worked with Olivia, who will be presenting next at PSE, which is Physicians, Scientists, and Engineers for Healthy Energy, which is a nonprofit research institute that focuses on energy production and use and how it impacts public health and the environment within three main domains, those being clean energy, energy and the environment, and environmental health. And both Olivia and I focused on the environmental health domain with two related but different projects. So my research project this summer was aimed at looking at the question of, can we develop a framework for identifying optimal regions of California to prune gas infrastructure? And this was really a domain that I had not worked in before, but I've been pretty interested in electrification and decarbonization for a while now, and was wondering how I could relate that to my career in medicine. So in tackling this question, I basically started by conducting a literature review to identify what potential metrics could be included when identifying a framework through which to retire gas infrastructure. And then based on those metrics, I tried to identify data sets that I could then use geospatial analysis techniques to map the data, and then kind of decide based on those maps which metrics should be included. So the main metrics that I kind of identified based on my literature review were looking at lower income and disadvantaged communities, areas with new construction or future construction, communities with gas infrastructure near the end of its useful life, communities that were willing to participate in the transition, and then also communities rebuilding from wildfires, which we know is especially relevant in California, as well as a few other metrics that we played around with mapping as well. So coming into this project, I had asked myself the question many times: how does climate change impact the population? And as a physician, how will it impact my patients? But I hadn't really explored the question of how will the solutions to climate change that we're coming up with differentially affect different communities. So I think that kind of taking that different approach and looking at it through a different lens is really valuable. And I hadn't realized just how impactful these different solutions can be in different ways to different populations. So for example, if we're looking at decarbonization, communities that are wealthier are certainly going to be able to adopt strategies to electrify more readily, which then kind of places the burden of maintaining the existing gas infrastructure on more disadvantaged communities. And so this divide is growing bigger and bigger in terms of who is getting exposed to toxins or pollutants and such. So one of the biggest lessons I learned in identifying and mapping these metrics was that gas pipeline infrastructure in California, it really should be accessible to the public, but it's not, which posed a big challenge in this project. So because of that, questions that we can't answer or which are more different or difficult to answer include how old is the pipeline infrastructure that is supplying my current home or apartment? Are there leaks in my neighborhood that I don't know about? What is the likelihood of a gas explosion in neighborhoods that I'm looking to buy a property in? So those are more individual questions. And then on a community level, which communities are exposed to more natural gas leaks based on the age or the construction of the infrastructure? And then for my project, how would we prioritize electrification and decarbonization if we don't have this information? So that was one of the things that I think I'm taking away from this project that I'm most passionate about, is kind of elucidating and gaining access to this information. So I've kind of spoken to this before, but some of the challenges that I encountered in this project were that it's not really enough to just think about an ideal way that we want to address climate change. We can't just say everyone needs to drive electric vehicles and not use gas stoves anymore. We really have to think about how it will disproportionately affect different communities. And I think this is applicable in a huge variety of spheres, not just decarbonization and electrification. And as I mentioned, one of the biggest challenges was that I just wasn't able to find reputable, complete sources on the California gas pipeline infrastructure from sources like PG&E or SoCalGas. And then on a more granular level, when I was looking at mapping a variety of different metrics, really all of these data sets are available at different levels. So you can look at census tract or zip code or county level for things like prevalence of asthma or residential building permits, but oftentimes they're not at the same level. So it's really a question of how do you overlay those and then kind of figure out general regions that might be more beneficial to prioritize electrification or decarbonization in. So starting the project, the goal really was to inform decarbonization policy in California, or at least attempt to do so. And I'm realizing coming away from this project that while that's, of course, the main goal, really what I think should be focused on is how do we access and make the gas pipeline data more readily available? Because I think it's just hugely important to both communities and individuals and research at academic levels. So in terms of my personal and professional value, I think coming away from this project, I have so much more knowledge about the different variety of resources available to assess environmental health burden in California. So one of the main ones is CalEnviroScreen, which I hadn't been previously aware of, but is a really wonderful tool that it essentially assigns a score for both pollution and population metrics to kind of assess where there are more disadvantaged communities in both of those spheres and at a more granular level. And then I was really lucky to be working with some mentors at PSE to focus on data visualization, and I had never done this before. So I gained a lot of experience in learning how to map and visualize these data sets. I just provide an example here. This data is from CalEnviroScreen, but essentially looking at asthma percentiles. So highest percent of, or the highest percentile of people with asthma versus lowest, as red, and then green as the lowest in all across California. But what I'm showing here is just the Bay Area. And then conducting my literature review, I also learned a huge amount about the nuance and complexity of developing California policy. And then, as I've mentioned multiple times, the big oil data availability, which I think is hugely important to focus on moving forward. So that is what I was asked to talk about. And I am very grateful to have had such wonderful mentors at PSE and also the EaRTH Center. And I'm looking forward to continuing research.
Thank you so much, Madeline. Now we're going to turn it over to Olivia Leventhal, who also did her community project at PSE Health Energy.
Hi. Oh, sorry. Okay. Can everyone hear me okay?
Mm-hmm.
So the broad category of the project that I was working on was looking at the potential health effects of natural gas odorants. And this kind of fell within a larger study at PSE called the California Kitchen Study, which is a study that they've been conducting over the past couple of years, collecting natural gas samples from people's homes through sampling gas from their stoves to figure out what exactly is in natural gas besides methane, because as Madeline alluded to, gas companies aren't super forthcoming with information about what's in the gas, where's the gas, and it's hard to find information about that. And I didn't know this before starting this project, but natural gas actually doesn't have a smell on its own. And so you have to add natural gas odorants so that you can smell natural gas and detect leaks. And natural gas odorants are required to be added to natural gas in the US because there have been some in the early 1900s or sad explosions that happened because large gas leaks weren't detected. So my project was twofold. One was doing a systematic literature review of the most common natural gas odorants. I'm not going to list all those names, and their associated health effects, mainly looking at human exposure events and then also toxicological studies done in animals. And then also I tried to help recruit participants for the California Kitchen Study in Fresno and Bakersfield, but that was a bit challenging. Next slide, please. So some highlights of what I learned from doing the systematic literature review on natural gas odorants is that there's a lot that's not known about natural gas odorants. For instance, it was really difficult to actually determine what are the most common natural gas odorants because gas companies aren't necessarily forthcoming with this information, and there's contradictory information. For instance, methyl mercaptan is one mercaptan that some say is not used in natural gas and others say that they have found it in natural gas. And so there's a lot of contradictory information on what are the natural gas odorants that are used. And then it's even harder to figure out what concentrations they're added at because there's no regulations on how much odorant needs to be added to natural gas. So for instance, the federal law just states that there needs to be enough natural gas odorants so that it could be detected by someone with a normal sense of smell. And this is usually tested by literally a person smelling the gas that has the odorant added to see if it's detectable. And you can imagine that there's a lot of variability between what is detectable and not to certain people. And then also there was just not a lot of literature on what are the health effects of natural gas odorants because it's not really actually known how much people are exposed to these odorants. But from looking at the data of human exposure events to natural gas odorants, what we did see is that there are some common acute health effects that have been observed, like headache, nausea, vomiting, diarrhea, irritation of the eyes, nose, and or throat, respiratory complaints, including asthma and difficulty breathing. And I think the asthma finding was particularly interesting because it's a potential susceptibility group for people who might have more severe impacts from being exposed to a natural gas odorant. But again, these were really just like acute health effects from someone being near a spill of either a natural gas leak or spill of just the odorant itself. And there aren't really any studies at all looking at long-term health consequences from these exposures. Next slide, please. So some challenges, as I mentioned, it was just hard to get consistent information, and there was contradictory information coming from different gas companies or from public health research. And a lot of the literature about odorant usage was not peer reviewed, but made from like white pages and people in the odorizing community talking about how to odorize natural gas. And again, not much information coming from actual gas companies. And then also some paywalls making it hard to get access to information that could have been useful. And then the community value, I think the main thing that this systematic review called to attention was the lack of information about natural gas usage in the United States and their health impacts. And we're hoping to publish this and make some recommendations that companies should report where odorants are being stored and how they're treating these odorants. There needs to be better equipment with lower limits of detection so that people can perform good exposure assessments of these mercaptans that are added. And there's just a lot of room for improvement for emergency preparedness for spills and leaks of these odorants and natural gas, and also increasing regulations for occupational and community exposures to natural gas odorants. And then so for personal and professional value, I think working on this project really highlighted for me the importance of connecting things that are bad for the environment to people's health, because when I was telling people that I was working on natural gas, they were like, oh, but it's so much easier to cook with a natural gas stove, which I agree with. But when you talk to them and let them know that there might be potentially harmful chemicals that's coming out when they're using natural gas stoves, then maybe you are able to convince someone that they should get an electric stove instead. And so I think making like climate change and things that are bad for the environment personal to one's own health is a really important tool that physicians can use and study so that they have evidence to back up these claims. And then also this was just a really great opportunity to collaborate with people outside of medicine and learn about how research is done in a really policy relevant and applicable way. And I'm hoping that I'll be able to work with PSE in the future. Thank you.
Thank you so much, Olivia. Now we're going to hear from Ana Claire Fernandez, who did her project right here at the Department of OBGYN and Reproductive Sciences at UCSF. I'm going to mute myself and let you take it away, AC.
Thanks, Anne-Marie. Hi, everyone. Good afternoon. My name is Ana Claire Fernandez. I'm a second-year medical student in the Berkeley UCSF Joint Medical Program. I'm going to talk to you today about my summer research on wildfire smoke exposure and pregnancy outcomes. So I had the pleasure of working with Dr. Amy Padula, who's an epidemiologist in the OB-GYN department at UCSF, who's part of a bigger interdisciplinary team that collaborates with toxicologists and other and physicians, and the collaboration of that team was something that I really learned a lot from, because the different members really had different expertise, and I was exposed to all of them and even got to see my first birth after shadowing Dr. Amelia Basilio, who was an OB-GYN resident who's on the Spark team. Next slide. So our main research question was how exposure to high levels of PM 2.5, which for those of you who aren't familiar, is a term used to describe these tiny pollutant particles that measure less than 2.5 microns in size, how those exposure to those particles may affect pregnancy outcomes like birth weight. And to start answering this question, we obtained birth data from UCSF. Our original data set had over 6,000 births that took place in San Francisco between 2018 and 2019. We also had access to a monitor that measured PM 2.5 pollution in SF. And so basically we took these two big data sets and we cross-referenced them to assign PM 2.5 levels to every day of each pregnancy in order to determine which pregnancies had been exposed to the 2-week peak of ambient PM 2.5 levels in San Francisco in November of 2018. And you'll see on the right that this is not our study, but is a good visual to describe how we stratified each pregnancy by exposure and trimester during exposure. That was done by Holsius et al. in 2012 that used 2000 California wildfire data that similarly sorted pregnancy exposure to peak PM 2.5 levels by trimester. And we also were trying to understand how varying degrees of structural privilege may affect birth outcomes. So we also tried stratifying pregnancies by indicators of privilege or potential barriers to care, which included things like sorting people by their insurance status, whether they were on Medi-Cal or private insurance, what level of education they had obtained, and maternal racial identity. Next slide, please. So in terms of the contemporary relevance of wildfires, I'm not sure that I need to spend a lot of time on this, but in September alone, there were 9 wildfires of interest that were reported on CAL FIRE. The Dixie Fire, which we've all heard about, has been burning since July and is mostly contained now, but it's contributed to air pollution, not only in the Bay Area, but also on the East Coast. I was visiting, I'm from New York City, and I was visiting home in July. And at one point, the AQI in Manhattan reached 138 for the first time in my living memory. That was in part due to a cross-continental wind bringing pollution, wildfire-related pollution from the West Coast, which was crazy. So it's affecting all of us. And so our results are very preliminary, and we're waiting on more birth data. But of interest, we found a positive correlation between exposure to the November 2018 peak during the second trimester and babies born large for gestational age, which is a term used to describe newborns born in the 90th percentile for weight, and which has a lot of potential clinical implications like complications during birth and other developmental issues. And more granularly, there was also a positive correlation between exposure in the second trimester and male newborns born large for gestational age, which is a finding similar to one reported in Australia by researchers O'Donnell and Behe in 2015. Next slide. This big table is basically a map of all the participants that were in the study, and I'm just going to highlight a couple of things. We had big challenges when it came to figuring out how social factors like socioeconomic status, housing infrastructure, and other barriers to care impacted birth outcomes. And one of the big reasons for this is that UCSF, which is where we were getting our birth data, serves a relatively privileged population. And I don't expect anyone to be able to actually like see some of the numbers in here because it's a big table. But out of the data set, over a third of births were associated with white mothers. 95% of participants were English speaking, and less than 5% were on Medi-Cal or public insurance. And so there are still many lingering questions because the sample size was basically too small to derive privileged stratified results. So we're waiting on new data with that. And we have a lot of lingering questions about how socioeconomic status and occupational realities shape someone's toxic exposure to wildfire smoke. So for example, is there a difference between women who must commute to work versus those afforded the luxury of working from home when the air quality is really bad? And how do variables like access to maternity leave, workplace protections, protective housing infrastructure, like access to air filtration, for example, impact these outcomes? And we're planning a study in the future with a more qualitative like survey component to perhaps answer some of those questions. And in terms of community value, my hope is that this research will help inform policy directed at protecting vulnerable communities who may be exposed to wildfires as they get worse in the future, unfortunately. And I'm hoping that once we get some of this new data and can do some more like privileged stratified analysis, that we'll be able to contribute a little bit to how to directives in terms of like how to protect poor pregnant people and people from other vulnerable communities that may not have the luxury of staying at home when air quality is bad. And to the right, you'll just see, this is a picture from an article in The Guardian in 2020 of a woman named Brittany Daskey who had to evacuate her home in LA with her 1-year-old while she was 8 months pregnant. And I thought that article, if any of you want to check it out, really helps to illustrate the need to address factors like stress, pollutant exposure, and physical safety in pregnant people during wildfire season. Because it's not just the wildfire smoke exposure, but it's also the stress related to that can affect pregnancy outcomes. And then in terms of personal and professional value. So before this study, I had no idea how to code. And I was joking with a postdoc that I worked with this summer about how I was having like epiphanies in the middle of the night in my dreams about ways to like get through coding problems and things, which is, I'm not sure is healthy or just like incredibly nerdy, but it is what it is. In addition, I feel like I learned a lot from Dr. Amy Padula about epi and statistical skills. She really was an invaluable resource and mentor to me. I feel like I really learned a lot from her. In addition, she set me up to precept with her colleague, Dr. Basilio, and the selfie on the right is me after seeing my first birth, which was an awesome experience. And I think has really helped solidify my interest in becoming an OB-GYN myself. This project has also turned into my master's project as a part of the Berkeley UCSF Joint Medical Program. And more generally, I feel like this project has really given me the tools to not only finish the current project, but also start investigating outcomes as they relate to more vulnerable populations that I hope to work with in the future. I have, for example, a special interest in immigrant and undocumented populations, and would love to apply some of the skill sets that I've learned this summer to those communities. And yeah, I just want to thank Dr. Padula and the rest of the Spark team for their continued support and mentorship. Thank you very much.
Thank you so much, AC. So we have time now for some questions from the participants, if there are any. I'm going to stop screen sharing and see if there are. I'm going to ask for Alana's help. I'm looking at the chat right now. So I don't see any. I see a lot of great presentations, which I couldn't agree with more. Yeah, they were wonderful. So if there are, well, I'll just give everyone just another minute if you have any questions to the environmental scholars. You could also raise your hand, and if not, I'm going to go ahead and ask Dr. Harrison to provide a couple of closing remarks.
Thanks, Anne-Marie, and great job, everybody. I echo what Linda Birnbaum put in the chat. Thanks, Linda, that you said you were very impressed. And I want to thank all the mentors and the supervisors, the host organizations, and all the people that provided support this summer. We couldn't have done it without you. Anne-Marie and I approached everybody, and you were just super generous with your time and helped the students identify projects, provided support. So it really is a family to sort of embrace this idea of research in environmental health and see everyone off to, I hope will be, a successful pathways. So again, thank you. We don't pay any of the host organizations, so it's all volunteer. And I think Anne-Marie and I just really appreciate it tremendously. We're getting some really good positive feedback in the chat. Does anybody have any last questions or feedback or comments, suggestions? No? Okay. Anne-Marie, anything else?
No, I think I I would just like to say that, and thank you for everyone, to our environmental scholars for all of their hard work. Also, thank you to our mentors and supporters, and for everybody who participated today. This is just the beginning. All of the scholars will now, as they've chatted a little bit about, be starting their research projects, and they will be presenting their research projects at our EaRTH Center Research Forum at the end of their 3 years. So I encourage you to keep your eye open for that. And if you do have any feedback or additional ideas for us to consider as we continue to develop this program, we'd be very grateful. We hope that this is its value added to the scholars academic program, professional development, but also to our partners, our community partners who are giving them an incredible educational experience. So with that, we have a couple minutes. You all get 8 minutes back to your day. And I just want to say again, thank you. And we look forward to seeing you at our EaRTH Center Research Forum, the first, which will be happening in November. So take good care and have a good, happy almost Friday. Thank you.
Thanks,
Thank you.
everybody.